So imagine waking up one day unable to speak.
Mm-hmm.
You can't order a coffee. You can't tell your loved ones that you love them.
Can't ask for help.
All of the things that we take for granted. And that is the reality for many people who've suffered a stroke or had some kind of an injury or serious illness. So today, our guest, Nikki Wells, is a speech pathologist.
Yeah.
And for her, she helps people to find their voice again. That is her, not just a job, it's her life's work.
So this was one of the patients.
And he'd had a stroke.
So he had a stroke. So when I met you for the first time, I'd fallen down at the bottom of a deep hole. You guided me to the right direction. You've done a hell of a good job. Now I can see the light. Oh, it always makes me tearful.
So beautiful.
Now I can see the light at the end of the tunnel.
So before we jump in though, if you really want to hear more stories from real people and having impact, then make sure that you follow and subscribe, because that really helps the show. It really helps us reach more people and keep sharing these stories.
We care for the land and sea. We care.
So today we are joined by speech pathologist Nikki Wells. Nikki works with patients who have had life-changing events and helps them to rebuild not just their speech, but their confidence, their identity, and ultimately their future. Welcome, Nikki, to It Takes Heart.
Thank you for having me.
Now, Nikki, you are our first ever podcast fan. You are also Kate's friend. So I know Kate's a bit nervous about today when your friends see you at work.
Really weird.
So she
Really nice. But it just...
We'll just excuse her if she's a bit weird. But
I feel like I'm fangirling
This
today.
is, and you've listened to one of the podcasts and then referred one of your friends at work who we've now got locuming around the country for us. So it's so nice to finally meet you, and I've heard a lot about you, and you probably don't know a lot about Nikki from a work perspective.
You know, we're mum friends. Our boys are best friends, and we've known each other for years. But I'm so excited because I genuinely don't know a lot of these things about you, and I can't wait to actually just find out you're a speech pathologist. I know that much. I know you're very passionate about your work, but maybe talk to us about what's a speechy?
What does a
What
speech
do you do?
pathologist
What do you actually do?
Great question. So being a speechy, it's such a wide field. I've got my best friends from uni. One of them works with kids that stammer. And then I have another friend that works in head and neck cancer. So it's a huge field. So I work predominantly in adult rehab. So I work with people who've had strokes. I work a lot with progressive neurological conditions as well. So people that have Parkinson's disease. So I see people at a time in their life where they've had something really catastrophic happen, and being able to help them through that is amazing. Yeah.
How did you become one? Because, I mean, I probably hadn't heard of speech really until I had children, and then everyone was talking about a speech pathologist. But
We have kids, and all of a sudden all these allied health
all the
professionals
allied
that we
health
need come out of the
professionals
woodwork.
Yeah, they literally did. How did you learn about it, or how did you choose to become one?
So McDonald's is the reason that I'm a speech pathologist.
McDonald's.
I mean,
McDonald's.
Fast food.
obviously.
Okay. Take us on the journey.
So I was really lucky that I was about 14 when I discovered what I wanted to do, which isn't the same for everybody. But I did a sign language course at school.
And where was this? Because you've got a little accent.
Yeah, so I'm Welsh.
Right.
So this was in Wales. So I did a sign language course at school. I was terrible at sign language, but the teacher that taught us talked about communication difficulties, and he used the example of McDonald's and how it's so hard to order in McDonald's if you can't speak. There's no menu that you can point to. You are really relying on verbal communication to be able to say what you want. And as a 14-year-old, my mind was just blown at the thought of not being able to order in McDonald's, which is quite embarrassing now as an adult.
No.
But at that time, it really resonated with me. And that sort of started me then on the journey of looking into professions where you could help people that had communication impairment. And so that's what led me to speech pathology.
Was adults always the preference? Because there are so many specialist areas. Like you just said that even just like head and neck cancer.
Yep.
You were 14. Was it always going to be adults?
It was always going to be adults.
Why?
For me. So I was very lucky. I've been so lucky throughout my career, actually, but I was very lucky that I got the opportunity to do some observation work in my local hospital. And I got to go and work actually in head and neck cancer as a 17-year-old, and got to sit in on some of the sessions and be able to see the work that the speech pathologists were doing. And that really solidified it for me of this is what I want to do. I want to be sitting in this chair helping these people. So yes, paediatrics was never going to be my thing. And when I started my degree, they did a hands up, who wants to work in adults and who wants to work in paediatrics. And I think there were 2 of us that wanted to work in adults at the start.
In occupational therapy, everyone wants
Yeah.
kids.
Really?
Yeah. It just... It's what you were saying earlier about being a midwife. Everyone thinks it's just working with kids and it's just sweet and beautiful. And
And then by the end, it was probably more
flips.
50-50. One of my greatest achievements in my work is when I switch a student from wanting to work in paediatrics over to adults. So I always ask them when they start, do you want to work in adults or paediatrics? And if they say paediatrics, my challenge for the placement is to try and convince them that adults is where they want to be.
And what are the reasons? Like how, if you're standing there with your graduates, and I know you do a lot of work with the people coming through, why?
Why do they need to be in adults? Yeah. How do you sell it to them?
So you don't have to
Here's your pitch.
You don't have to make games.
That's true. I do peds as an OT and it's a lot of games.
You don't have to sit on tiny chairs.
Better for your knees.
Sit on the floor. Yeah, much better for your knees.
Yep.
So I think the big thing, and actually both of my sons have had a lot of speech therapy. So I've kind of been able to see it from the other side as well. And I think with the difference with adults is that they are there because they want to be there. They want to improve. And a lot of what I do is very goal orientated. So working with them to achieve their goals. With children, it's not their goals. So everything is around convincing them to do it and disguising things. Whereas with adults, it's like, right, well, this is what we want to work on. Let's get on and do it.
Yeah.
If we do this, we can
this will happen.
get here.
Yeah.
And have you been in the private and the public system? Is there a difference between the work or, between those two settings?
Yes, I think the biggest, so I work across both. So I work for Queensland Health and I work in private practice as well. And I actually love doing both of those roles. I find that being able to work in the public system, so the patients are very similar. They're often at different stages in their journey. So in the hospital setting that I work in, it's often in the first few days, weeks, months of them having a stroke, whereas in the private work, they've kind of gone through that process and they're now back in the community.
It's kind of the next stage.
Yeah. But the types of patients, so the types of conditions you're seeing are the same, but they're often at different stages in the journey. Yeah.
Do you ever get patients that you've seen sort of directly after that then might seek you out to continue? Like, is there any sort of, that continuation of care?
No. So they would, so it's completely, completely separate. Yeah.
So you must have had such an incredible impact on so many patients' lives. Is there one that stands out to you?
So I've had so many. There have been so many patients over the years that have really touched me. And I think for me, those patients that work so hard to achieve their goals, and And I'm in a really fortunate position in that I work in a position where I'm able to see people for a long time. So I have...
Yeah, how long would you have a patient with you that you'd be working in the hospital?
So I have had a patient that I saw for a year, and that's so wonderful to have that opportunity to work with those people. And often language and speech recovery is not a quick fix. It is something that takes a long time, and being able to build up that rapport and work on small goals and build up to bigger things. Yeah.
So what kind of, like, if you had a patient first day and then a year later, like what's the growth in that progress in that instance, for example?
So it really varies from person to person, and that is often a really hard thing for stroke in particular, is that everybody
One size doesn't fit all.
Yeah, everybody asks the question, when will I be better? And unfortunately, we can't answer that question because it's different for everybody. There's so many factors. So the size of your stroke, where the stroke was, your age, there's so many things that impact on it. But we can go from people in the early days. I had one patient that he went from not being able to say anything, could not get a single sound out, and he got to the point that he was able to have a conversation, and he joined conversation groups, and he was looking into volunteering at the hospital. So we can make huge gains with people, but that isn't the experience for everybody, unfortunately.
They must be so grateful for the work that you do.
Yes, sometimes.
There must be a lot of work with the families as well at times, is there? Like if you're saying that communication is challenging, if existent, do you have to then build those bonds and get the buy-in and the trust from the families? Because
definitely.
I guess if there's a lot of work to do in between sessions and things.
Definitely. And that education for the families is a huge part of what we do. One area that I work in is aphasia rehab. So aphasia is when your language is affected from a stroke. And when I talk to families, the hardest thing is when you're saying to them, your husband can no longer understand point to the table, for example. That's a really hard thing for a family member to hear, because your instant thought goes to, well, they're a really intelligent man, like they're a lecturer at university. What are you saying? He can't now understand point to the table. So I will often use an analogy of, it's a bit like aphasia is like being dropped in Japan if you don't speak Japanese. So you are still the same person. You still think the same way. You still have the same opinions about things. You've still got the same intelligence, but you can't understand what people are saying to you, and you can't communicate what you want to communicate. And I find that helps more than just that he can't understand this and he can't understand that, as a way of families understanding that it's not about intelligence, and we recognise that their relative is still that same intelligent person. Their language has just been affected by the stroke.
That's I got to say, I was an exchange student at 15 in Japan, and I was in a McDonald's and couldn't order food. So when you were saying that and then bringing it back to like your full circle, I was like, I remember being like, we couldn't order food anywhere because we were so young and we didn't speak a great deal of Japanese. And then, yes, we were in McDonald's and we were just like, how do we get food here? Like,
full circle moment.
There you go.
Thinking about that now, if you think about if you walk into McDonald's now, there are touch screens and various things where maybe...
So many gains have been made since...
So if you think about technology in your field, how has that impacted your line of work?
Oh, it's been massive, actually. I
know that we're 25 and we're still learning. But
when I was in Japan 10 years ago.
This is what I mean. You know, I'm sure those screens were there, Sam.
Yeah.
I
just didn't see them. But with AI, introduction of telehealth, it would have gone in leaps and bounds.
Yes. Absolutely. I am the least tech-savvy person you will ever meet in your life. I don't know how to do anything on computers. Excel scares me. So it has been a very steep learning curve for me, and I'm still very much learning.
Do you find the grads coming through?
Oh, yeah.
Have that in spades?
Yeah.
Because that would be quite daunting, mentoring grads, because obviously as an occupational therapist coming through, I remember looking to all my mentors and whoever had the placements for you, and they knew there was nothing that we were bringing or knew that was different. Whereas now with tech and so many changes so quickly, you'd be like, they'd be almost up to speed in some way and different, or ahead in other ways.
Yeah, I actually love that. I love learning from all the people that I work with, and it's great. Like when we get new grads that come through, like you can learn so much from them because they are really on top of what the latest evidence is as well, and what they're being taught at uni and how we can apply it into a clinical setting. And yes, certainly the technology, they can teach us a lot.
Can you give us some examples of how that's improved?
Or change treatment or how you interact?
So a couple of things. So in terms of the technology, we now have so many apps that people can do therapy on, which has really transformed how we do therapy. So we're able to use the apps in sessions. So it's a lot less paper-based resources that we used to use and photocopying
everything up. The Allied Health photocopy would always be like, especially down in paediatrics, like go.
Yeah, so we've definitely been able to move away from that a bit more now, which is really good. And it's also great that we can lend iPads out to patients so that they can use those apps at home or on the ward if they're still on the ward. So that's been really fantastic to be able to have these more resources. In terms of telehealth, I think telehealth has been a game changer in speech.
How so? Because the concept of speaking
telehealth, is it telehealth on a screen, like a Teams video call, or is it telehealth on the phone? Or am I? So it's my little phone signal. Again, I'm 25. So
it's predominantly video. We don't use Teams, but a platform very similar to Teams. So we had a big uptake in telehealth during COVID, as everyone else in health had. And during that time, I must say I hated it when it was first brought in, but I think because we had such a steep uptake of it. But I run communication groups in my work, and I was running a communication group at that time, and we were able to transfer that onto telehealth. And it meant that for those 4 people that were in that group that were otherwise isolated because they weren't able to communicate very well, that was an opportunity twice a week that they had social contact, and they were able to communicate in a safe environment about what is going on. We don't understand what's happening. And so we were able to use those groups then to provide some education about COVID, because for them, if they've got difficulties with understanding, being able to understand all that information they were getting from the news was really confusing. So it allowed us to provide some education for them to have a bit of social contact during a time when they wouldn't have got that otherwise. And they were able to still continue to have their therapy, whereas they wouldn't have been able to because they were a vulnerable population, not able to come into the hospital. Telehealth has also been great in terms of my private work. Like I see a patient who is in a different state. Who
Yeah, I was thinking about that with like rural and remote communities, like for
Yes.
them to have that access as well.
And so he lives in a small community where he doesn't want to access speech pathology in his community. Because
Why is that?
Is that a stigma thing?
I think maybe a bit of that and a bit of, I don't want people to know my business.
my business.
Yes.
That's hard in a
So-
small town, isn't it? We've found that a lot with getting their own help.
Absolutely. And so telehealth has meant that he is able to access the services that he needs in a way that feels comfortable to him.
Do you think that the introduction of all of this tech has actually meant that you're able to treat patients faster, or are you getting better outcomes in the same period of time because you've got more resources that you mentioned to use? Like, is it getting better outcomes?
I think so. Another environment. So I work in a day hospital setting where people have been in the inpatient ward. And then they're ready to transition home, but they're still needing intensive therapy. So for those patients, previously they would have to come back into hospital 5 days a week. They usually are not able to drive because they've recently had a stroke. So they're reliant on family bringing them in or using public transport to get in for those sessions. So telehealth has meant that we are able to maintain the intensity of therapy that they need, because instead of having to come in 5 days a week and then them not being able to make it because it's just too much, they are able to come in twice a week and have 3 days a week of telehealth instead. So
good to support it, isn't it? Do you think that we'd be here if we hadn't come through COVID? Like, do you think we would be doing so much telehealth now?
Like where you say it fast-tracked it.
Like we sort of had to do it. So has it really, fast-tracked it, or would we be here anyway?
I think we'd probably be here anyway. I think it was evolving and there was certainly more research coming out prior to COVID about the use of telehealth.
I remember as a grad 10 years ago, /15, it was available then, but there was not a great uptake. Like it was almost a rare event. It was a special event. There's a telehealth.
Yes.
Yeah.
Yeah. I think
if you meet a certain criteria.
Yes.
Yeah. And I think what COVID did was show us the benefits of it, because I think prior to that we were all possibly a bit focused on how hard it would be. And now we've been able to see the benefits and try to maintain that.
Almost outweighs the negatives there. Like it really fast-tracked that.
Yeah, and there certainly were some negatives. So one of the things that can happen with aphasia is that you lose your ability to understand numbers, which is very challenging for people when it comes to PIN numbers. So when we first started doing telehealth, we had to use a system where you had to put in a PIN number. So we spent an hour speech pathology session trying to get this poor man to be able to put in a 5-digit PIN number
to get
into the session. And so we were saying the numbers to him, but he couldn't understand the numbers. And he was trying to put them in and was putting in incorrect numbers.
Oh, that must have been so stressful for him too. Like that would have... that would have had an impact on your confidence and kind of like steps forward, steps backwards.
And just listening to you over the years and knowing that you work with people around their speech or, being able to eat and things like that, I feel I was just a bit naive and hadn't thought about the ability to understand as well. Like that hadn't really... I hadn't realised that, because that's just an extra element, isn't it? To learning to speak is one thing, but if you can't understand as well, that's
it's huge.
That's really challenging for someone. It's so impactful, the work that you do. Can you share maybe a couple of instances where you feel like that's really, I'm doing what I'm meant to be doing, and it's
something you're really proud of, where you've had a real impact?
Impact, or
so. Again, there have been so many of those moments. I think for me, it's always the firsts. So being there for someone where you've been working on them, being able to say their grandchildren's names again, and the first time they say their grandchildren's names, or someone who's lost their ability to swallow after having a stroke, and the first time that they're able to have a cup of tea again. So being with people for those firsts. And I get some really lovely feedback from people. And I've had one particular patient. Can I read out?
Yeah. Because it must be hard as well when you sometimes send people on their way, maybe after your sessions have finished, I imagine. And you must, I mean, I know I would be wondering, wonder how they're doing. Wonder how
are they?
Did they progress?
Yeah.
Did it stop? Did it continue? Like,
Yeah.
I know I sort of like need to know stuff. So that would really be difficult for me.
Yeah.
Do you ever get that, you know, learn in the future of what's happened and outcomes?
Yes, sometimes you do. Sometimes they come back, and that's really lovely. Like they come back and visit, and you get to see how they're doing, which is always, it's always really lovely. But yeah, there are certainly some that stay with you, and you think, oh, I wonder whatever happened and how they. Yeah,
Where they are now.
Where they are now, yeah.
So you've got some feedback?
Yes. So I got this to give context. So this was one of the patients that I was able to see for a year. And when I first started seeing him, he couldn't produce any sound at all. So that's sort of where we were starting from.
And he'd had a stroke.
So he had a stroke, yes.
And how long did you work with him?
For about a year, we worked together, and he was very, very motivated, and he would do a huge amount of practice. And he got back to be able to talk in conversations. So he sent me this card when he finished with me. So when I met you for the first time, I'd fallen down at the bottom of a deep hole. It was stark dark. I was wordless. I was hopeless. I was nothing and meaningless. I even did not know how to move my mouth. I totally forgot it. You shared my feelings of desperate need. You guided me to the right direction. You've done a hell of a good job. Now I can see the light. Oh, it always makes me tearful.
So beautiful.
Now I can see the light at the end of the tunnel. Yeah.
That is so beautiful.
That is. Did you get that at the end of the 1 year?
Yes, yeah.
Oh my gosh.
And just for patients like that to understand that little bit of feedback, how obviously impactful that is to you, that you're so invested in their journey.
Yeah.
That's absolutely beautiful, like to see that.
I feel like I need a tissue now.
I'm like
behind you, there is a tissue actually.
There's one down there.
There is. So that's a lot to
I was just about to
walk
say that. Like, I'm like,
through.
does that happen all the time? Because yes, if you're like,
You're carrying
even
that
if
with them.
and those hard days of therapy when, like you said, they're in the darkest place, and
People must get angry as well. Like, do you have a lot of patients? I'm just trying to put myself in that position. You know, you'd go through such a wave, and you're there nursing them through it, guiding
keeping
them.
motivated, keeping them,
Yeah. So we do, yes, you get the full breadth of emotions. I'm very fortunate to work as part of an incredible MDT.
What's MDT for?
So multidisciplinary team, and we have a psychologist on the team, and we have social workers, we have amazing doctors that work on the team that are really, we use the term MDT focused. So it's where they really value the opinions of everybody in the team. And so being able to work in that team means that those patients are supported by the whole team, not just by us as one individual. So we're not having to carry that load individually. It's shared amongst the team.
and you've also got each other there as well. You know, like a good team.
Yeah.
What do you do personally? Like, you're a pretty busy person. You make me feel like I should do more a lot. What do you do to balance that out and make sure that your well-being is looked after, to make sure you can keep supporting others?
Well,
and your family.
I drink wine with you.
That's the theme in this season.
Just to be clear for those listening, Nikki drinks wine with Kate, not me.
I believe she has drunk wine with you.
I don't know.
My big thing is running. So I do.
You're a big runner.
I'm a big runner in all
We're not
ways.
talking a couple of Ks.
Like marathons?
Yes. So I've done a marathon. Yeah. So that's
Trail running, marathons,
Yeah.
mud obstacles.
Do you do that because you love that? What, like...
So I love it. I love.
That was a weird question, but I was more like, is it because you love it, or is there another reason
it's a
behind
va-
it?
it's a
Like,
And you
valid
push yourself
question.
even on a day, like you might have had a really late night and maybe you don't feel like it because maybe you've been at my house or something. But you still, I talked to you later, you're like, yeah, I went for that 25K run this morning. And I was like, what? I just managed a piece of toast.
Yeah.
Like, what do you mean? You push yourself through.
Yes.
Why do you do it?
I love it. I think I love the sense of achievement. And I am very goal driven, which I think lends itself to working in rehab. And so I like with running that I set myself a goal of I'm going to run a marathon, and I will run a marathon. Yeah. So if I set myself a goal, I will make sure that I achieve it.
and I suppose
Yeah.
when you're working with patients and you're setting them goals, if you weren't someone who was that way inclined, setting your own goals, there might not be that empathy on the days where they don't feel like it, or helping them to break that goal down into mini steps. And you're not going to run a marathon on day one. It's
Because they must
Yeah.
have setbacks just like you would in your running.
Yeah.
Like huge, you spoke recently about
just like me and my shred that I'm
Really?
going on at the moment. 10 days and
we
then I
can
had a
relate.
setback already.
But you did a big run recently, and I know you were telling me about, in the first 5Ks of 25Ks or something? You were
30 it was, yeah.
Like you were, you were struggling.
Yeah.
And I was like, why didn't you just stop? Like, it wasn't like you had 5 to go. Like, that would be an okay moment for anyone, I think, to go, maybe today's not the day. Like, maybe it's just not today, maybe next time.
Yeah.
But you were like, no.
I paid my money. I was doing that
You're
run.
like, I'm going to get my money's worth.
But you do. I imagine you manage patients who are having those setbacks all the time. And I guess,
Yes. Yeah. And it's obviously not in any way comparable.
No.
The journey that they're going through compared to my self-imposed punishment.
Yeah.
But I think, yes, it certainly does, like having that mindset of you're there to work towards a goal. And I think being able to talk to patients about that and working through those barriers and how do we get through it to get to where you want to be. Yeah, there certainly is some crossover. Yeah.
What's something that people, misunderstand about speech or don't know about speech? Like I think about, as an OT, everyone just assumed we just did grab rails and shower chairs.
Yeah.
You're like, yes, they do. There was
I'm,
more.
I'm definitely aware of that misconception.
There's that.
Yeah.
Is there a misconception about speech or something that you wish people understood more that might attract more people into the profession? Or
Yeah, I think the biggest misconception is that we only work with children, and that certainly isn't the case. Like in my week, I will do I do X-rays on people's swallows, so we're working with radiographers, radiologists, doing X-rays of people's swallows to work out what the problem with their swallow is. We're seeing people in acute wards. I have colleagues that work in ICU, so in the intensive care unit. We're working across a huge range of settings, and then there are lots of people that work in the community. So there's a huge breadth to it. And I think the other misconception is that there is so much learning. So it's an evolving profession. And that's what I really love about it, is that you can, every day you learn something new, and the more people you get to work with, you learn something. And there's so much more evidence and new evidence coming out all the time that it's a really exciting profession to work in, where you're always getting to change your practice and make things better for our patients so that they have the best outcomes possible.
Is it, when you talk about the breadth, is it common then for someone to start in paediatrics and go to adult, or to specialise in one? And, you know, like in terms of your career, do you find most speeches would just stay in the one lane, one specialty?
I think my personal experience is that I did work very briefly in paediatrics when I first graduated, but it was very short-lived. I did lots of therapy in a broom cupboard in schools for about 6 months, and then I transitioned across to adults. There are people that work in generalist posts where they get to work across both adults and paediatrics, and that's their role.
Imagine if you work in a more rural area, you would have to be a generalist. Would that be right?
Yeah. Which I think, like, they're amazing people that are generalists, that are able to sort of switch from...
switch gears between adults, children. It's quite different.
Yes.
Like approaches to therapy too.
Yeah, absolutely. But my experience has certainly been that most people will specialise in either adults or paediatrics, and then beyond that, you then specialise in different areas.
And would you change within those areas often, or is it more like you're going down that stroke, neuro rehab, or do you go that and then you might go head and neck?
So it depends on where you're working. So lots of hospitals in particular will have rotational posts where you get the opportunity to rotate through different fields within adults. So you get the opportunity to work in that acute care versus rehab versus voice therapy and head and neck. And so... yeah, there's so many opportunities.
You can get good exposure to then try and guide you to where you might feel is fitting for you.
Yeah, and then it tends to be later in your career then that you'll decide on one particular route.
Do you think we'll ever convince you to take a holiday and go and locum around the country for your annual leave?
Oh,
you've got the camper trailer.
Got the camper trailer.
Take Dave and the kids.
Oh, yeah, it would be amazing. Taking a year
little
off,
sabbatical.
Go around. Yeah, it would be amazing. Sign me up.
I think you will. I think it's...
I was like, on your holiday.
One day.
Surely you'd be up for some long service leave soon.
Oh, yeah, probably, yeah.
You're probably up for that too soon. Anyway, we can talk about that another time.
Yeah. So with every episode, as you know, CMR donate to a charity of your choice. Can you talk us through where that money was going for you?
So I am working on a project in my work at the moment, working on getting people back into the dining room. So on our rehab ward, we have a lovely dining room area. And prior to COVID, all of the patients every day would come out into the dining room and they would have their meals. It was an opportunity for socialisation, a bit of normality as well, because who at home eats their lunch in bed? And also there's lots of evidence around the benefits of eating at a dining table in a shared space. But unfortunately, when COVID happened, that dipped off. And so it sadly just hasn't returned. So I'm working on a project to get everybody back into the dining room, and part of that, we want to spruce up the dining room a little bit, so make it a bit more inviting. It's a very clinical area, and so I would like to donate the money to the Logan Hospital Fund so that we can use that money to buy some things to make the dining room a bit prettier. So a karaoke machine.
Oh my God, that is not where my mind was going.
I was thinking a nice tablecloth.
I was thinking some greenery. We're going to oh my God, is there like a disco ball as well to go?
Maybe.
So why karaoke? Can I just ask?
So again, there's lots of evidence of the power of music. That's certainly not my area of specialty, but we will have people. So music is really powerful in that it's something that everybody has in common. Even if you don't like the same music, genre, you've got music in common. We also see people who are really have got really impaired communication, but they can still sing. So they can
That's
they
incredible.
can recall some of the lines of a song, but they might not be able to talk in sentences. And so it can just be a really uplifting experience for people at a time when there's not much that's particularly uplifting. Yeah.
I love that. Can you please send us a little clip?
Yeah.
I tell you
on-
what, we learn
So-
something every single episode from every guest. Like that really,
Yeah.
that was not where my brain went.
No, not at all. Not at
Thank
all.
you.
I love it. Thank you,
Yeah.
Nikki. And thank you for coming and having this journey with us from the beginning. You've been, such a fan and
Yeah.
referring your friends. But
Your whole team will be really excited.
Although
See
I'm
you.
very
So
disappointed
will the kids
that
when
there
Mum's
was
on
no
YouTube.
wine. I would listen to Lorraine's episode and I was expecting wine.
Well,
Sorry, we had a
I'm
morning
just glad
recording.
that-
I should have booked you for the afternoon.
But that was because Lorraine's hobby was wine tasting. Imagine if we'd made you run around the block with us while we were doing this. Like, I'm just glad we didn't get into a run.
That is true. Yes, no, we weren't diving into that hobby.
No, but thank you for your time, and thank you for teaching your friend Kate all about speech. Do you know so much more now? It's going to be a whole different
I know you so
conversation
much
the next
more
time
now.
you catch up.
Yeah.
That's fantastic. Thank you
Thank
so
you.
much.
Good. Thank you. Thank you for having me.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.